What I hear you guys saying, again, from the patient perspective, is when I think of the different tools that dentists use, I think of drill and I think of needle and I think of, knife potentially. A laser sounds least scary and the least possible to cause pain. It just sounds like that would, and it totally makes sense to me, that would cause not only the least pain when it's happening, but also in terms of recovery as well. So it sounds like technology has really done well for keeping pain down to a minimum.
I know the subject of this video to some extent, or to a large extent, is IV sedation, which Tom and I use. And I use it maybe even more than Tom, because I use it on virtually every single patient, unless the patient doesn't want it. And that's really, really rare. And so the procedure that we use is, first we give the patient something called Xanax, which is a mild anxiety or tranquilizer, let's call it. And then we do the IV sedation with something called Versed, typically, or Valium, but usually Versed, which may last, several hours. But when they come out of it, they're still kind of relaxed because we've given them the Xanax. So there's not a sudden wearing off of the IV sedation. The IV sedation wears off, but they still have a mild sedative going on in their bloodstream. So it's not a shock, and they continue to be relaxed. And by the way, let me mention one other thing. This has just been approved by the FDA. We have not used it yet. It has just been approved by the FDA. It's called, this is the commercial name, Bifavo. Bifavo is a very short-acting IV sedation drug. It's in the same category as Versed and Valium, but it's ultra short-acting. So in certain cases where we're doing a very short procedure, we may be using this. And this has just been approved within the last, I think, 2 weeks or so by the FDA, and it's going to have its place. And of course, if the procedure ends up being longer than we expected, we can always give additional of this if necessary. So this is another new tool that Tom and I are going to have available in our practice of sedation and keeping patients relaxed and comfortable. Let me mention one other thing. If the patient's not relaxed, I'm not relaxed.
Sure.
So it's almost as important for me to be able to do what I want to do if I know that patient's comfortable. So this IV sedation is for the operator, that is the periodontist, as well as for the patient.